What medications impact celiac disease testing accuracy? Imagine going through the process of testing for celiac disease and wondering why your results might not be accurate. Some medications can actually influence the test outcomes, making diagnosis tricky. If you're on certain drugs, your blood tests might not tell the full story. Corticosteroids and immunosuppressants are two big players here. These medications suppress the immune system, which can hide the inflammation caused by celiac disease. When this happens, antibody tests might come back negative even if you have the condition. So, you could be missing a diagnosis because your immune response is dampened. Omalizumab is another medication that can impact testing. It is a monoclonal antibody that binds to immunoglobulin E antibodies in the blood. Since celiac disease testing often looks for specific immunoglobulin G and immunoglobulin A antibodies, omalizumab can lower these levels and make tests less reliable. Heparin, a blood thinner, can interfere with the measurement of tissue transglutaminase antibodies. These antibodies are a key marker used in blood tests for celiac disease. If you are taking heparin, your results might not accurately reflect your true antibody levels. Proton pump inhibitors and histamine 2 receptor antagonists are medications that reduce stomach acid. These drugs are linked to a higher chance of seronegative celiac disease, which means you might have the disease but test negative on blood tests. They can alter digestion and immune responses, making antibody production less predictable. Most other medications like antibiotics, antihistamines, and antidepressants generally do not interfere with celiac disease testing. But it is always best to tell your healthcare provider about all medicines you're taking before testing begins. Do not stop any medication without medical advice, as this could affect your health. If you are on medications that could impact your test results, doctors might suggest alternative testing methods. These could include intestinal biopsies or other diagnostic tools that are less affected by immune suppression or antibody levels. Being aware of how medications influence testing helps ensure you get an accurate diagnosis. Proper diagnosis is essential for managing celiac disease and sticking to a gluten-free lifestyle. If you suspect celiac disease or are preparing for testing, always discuss your medications with your healthcare provider. They can guide you on the best approach to get reliable results.